But I do want to at least give you the cliff notes. We're in a worse situation now than we've ever been in this COVID pandemic since it started, a year and a half plus a little more ago. So what I'd like to do is I've been trying to help the health department, the governor's team, expand folks' understanding of what's going on, where we are, why we got here, and hopefully how we can get out of here. We're in the hot zone. We're no longer the #1 state. Florida has surpassed us in that over the last week, but over the last 2 or 3 weeks, we have really lost control here. Let's go forward. And you'll see we're on this upward spike as a nation that is actually on a steeper slope than we were originally last year. The slope of that line going up is much steeper than it was, except for maybe back in November when we had the holidays and other issues going forward. Let's go forward. And here are our numbers. We had 3,000 new cases reported over the latter part of last week, and so this is really, I think we all hoped in May and June that we were at the end of the tunnel, and unfortunately we find ourselves back in the middle of it again. And the reason for that is this virus has mutated. We are not fighting the same virus that we were a year ago. Where we are, we have about 3.2 million citizens. We know 400,000 Arkansans have been infected and had a positive test. The number there is probably twice that, maybe 3 times that, because not everybody who gets infected gets sick. Today we have about 23,000 active cases. We have the highest number hospitalized over the last few days that we've ever had. And we have the highest number on ventilators now, almost 300 folks fighting for their lives on ventilators. I want to draw your attention to something that drives me crazy. But when Secretary Romero and the governor say, well, we're down 20 hospitalizations, and we're down 15 ventilators, but we have 30 deaths. The people didn't walk out of the hospital, okay? We're down hospitalizations and we're down ventilators because we had people die, and they're not coming back. So I just wanted, this is a deadly condition for many folks here. Now, we restarted 2 weeks ago as school's coming back into session, the number of new infections in each school district per 10,000 residents, okay? So this is how much COVID there is in the community that's gonna send their kids to school, send their teachers to school, have the bus drivers go. The purple school districts here have more than 100 new cases per 10,000 residents. And I want you to do a little math with me. 100 per 10,000 means that 1% of those residents have been newly infected in the last 14 days. And we're going to school next week. Some of these school districts, one of the school districts, I've forgotten which one, is at 3%. 3% of all the residents of that school district have been newly infected in the last 14 days. So we've lost control. I know everybody wants to say, well, let's just play through it. But we're on a spike here that I think is a significant cause for concern. We are trending at school districts. If you want to look at the school districts of how they're doing on our website, we started 2 weeks ago, and so each Thursday afternoon we put another number up here. These are the top school districts that have some of the highest infection rates. We're also doing county or zip codes. So these, if you want to know what your zip code burden is, the darkest zip codes here are again more than 100 new infections in the past 14 days per 10,000. So those are 1% of those zip codes are newly infected. Our hospitals are, while no hospital CEO ever wants to say they're in trouble, our hospitals are very, very on the edge, both in terms of the people that they have in the hospital, but our teams have been going at this for a year and a half now, and they're tired. So, I mean, not only are our hospitals full of COVID, but we still have heart attacks happening every day. We still have appendicitis happening every day. We still have babies being delivered every day. And so this is really a burden that it's important for us to do all that we can to try to reduce that burden. Here are our hospitalizations per day, and we are at the highest we've ever been now. We have more people with COVID in the hospital than we ever had. If you're following the governor's comments, they are going to contract again with Baptist Hospital to convert their hotel into basically a semi-hospital unit so that you can be there and seek and get treatment. Now, I just want to say, they talk about beds and ventilators and rooms. it takes staff to be able to take care of people. And so we're having to try to recruit folks back into, nursing support, respiratory therapy support, physician support, that haven't been on the front lines in a while. So we are stretching our system, and I think it's a concern that is not being amplified enough. I mean, I know we all want to get through this, but the numbers don't lie. We are going up, and we're going up quickly right now in our healthcare system across the state. We are seeing younger and younger folks hospitalized, and unfortunately younger and younger folks succumb to the illness. We've had 3 children die that we know of in the state of Arkansas. As I mentioned, the largest group now is less than 45 years of age. We got our older folks vaccinated, and it appears to be protecting them. It's our younger folks that are unvaccinated that are having the greatest problems with us. And it has shifted. This is I guess I can move, Ken. This is a graph of hospitalizations. Here's where we were back in November. And you can see that most of hospitalizations were in people over age 65 or over age 75. It's really dropped down now, where the majority of the populations that are hospitalized are younger individuals below age 45, and including some teens and younger kids in that display also. We're also learning more, and this is fortunate and unfortunate. We're learning more about what this virus does to you. There's a kind of long haul symptom, people that get sick or maybe even are asymptomatic, but they will then develop symptoms over the next several months. It's a wide range of kind of physical and mental things. This is, fatigue, heart palpitations. You hear people talking about having a brain fog where they can't remember things, kidney problems. These are issues that you do not want to have, and that's why another reason you don't want to get this virus. A couple of studies that have been done of 20,000 people who tested positive, and they weren't necessarily sick, but they tested positive. About 13% had symptoms 3 months later. About 10% had symptoms 12 months later. So for about 10% of folks, this thing is a long haul issue, and it does appear that it is affecting younger adults too, with about half of young adults that tested positive having some sort of symptom at 6 months of age. So, I say this somewhat, if I tried to design a virus, I couldn't have come up with one that was worse for us. For a lot of folks, you get infected and you don't even feel sick, so you're spreading it. For other folks who do get sick, it can push them over the cliff quickly if they've got comorbidities. And then for a significant number of folks, you may develop symptoms over time that are going to last with you for a longer time. So again, my message is not one that I want to be delivering, but I think it's one that's important for folks to understand and hear. I want to pause on this for a second, because I think some of the hesitancy around the vaccines are because of the speed with which it was developed, and obviously the political polarization that it came under the umbrella on. But at least the Moderna and the Pfizer vaccines are really remarkable new technology. They took a picture, a DNA profile of the virus, and in those vaccines, they give your immune system a picture of what the spike looks like without necessarily exposing you to the virus itself. And so if your immune system then has this FBI most wanted list picture, so that when the virus comes in contact with you, it's able to resist the infection and fight it off. The Johnson vaccine uses an older technology. It's an attenuated virus. It's a virus that can't make you sick and can't replicate. But again, they put the profile of the COVID-19 virus in that attenuated virus. That's the one that is only one shot. So the Johnson vaccine is one shot. The Moderna and Pfizer are 2. A tidbit that I found recently, I said, was this the first messenger RNA vaccine, Pfizer and Moderna? Because the speed with which it was developed and concern about its safety. And actually, no. In December of 2019, the FDA approved a messenger RNA vaccine against Ebola. The pharmaceutical companies have been working using this messenger RNA stuff since the Ebola outbreak in 2014, when we were worried that that disease was going to spread from Africa and become a pandemic worldwide. They were using and developing the technology of the messenger RNA. The FDA approved an Ebola vaccine in December before all this stuff started. Now, it didn't get nearly as much attention. I didn't even know about it until I went to look for it. And then they used that technology and the profiles of the virus to get these vaccines through the process. And they did all 3 stages. Phase 1, which was safety on a small number of people to make sure it was safe. Phase 2, which is for effectiveness, to say, okay, does it stimulate your immune system to give you a response? And then they did phase 3 in tens of thousands of people that they randomized. Some people they gave placebo, some people they gave vaccine. And they found that these vaccines, at least on the parent virus, were over 95% effective and incredibly safe. The flu shot is about 60% effective. So that's how remarkable some of this new technology is on the original parent vaccine. Now we've got the mutation, and it's affected the effectiveness of the vaccine on keeping you from getting infected. We're having breakthrough infections. But the vaccine, by giving your immune system that FBI Most Wanted list, is preventing hospitalizations and the bad outcomes if folks are reinfected. Unfortunately, we're not doing very well as a state. We're the 4th lowest vaccinated state in the nation. For our teens between 12 and 18 that are going to go to school next week, only 20% of them are fully protected by vaccinations at this point in time. And so, we have the tool offensively to break the back of this virus, but we're not deploying it or taking it up. And one of the things I think that's important is for reinforcement, support, education, meeting people where they are. We all tend to be a little bit fatalistic. Well, I'll just see what happens. This is not a time that we need to wait and see what happens. This is a time that we really do need to step in and take some action. For folks who've had COVID, it's still important to get vaccinated because you're giving your immune system the best profile. Some people that got COVID didn't have any symptoms, may not have gotten a full exposure, and so you want your immune system to have a full exposure so that it remembers as long as possible what COVID looks like. The emergency use versus full authorization, we've all become epidemiologists and virologists and vaccine experts in the last 12 months and not wanted to. But the FDA process is usually a long process. Usually for vaccines, it'll take 2 or 3 years to get full use, in part because they're still following the folks in those trials to know when their immunity starts to wane, to know when everybody would need a booster shot. Okay, so part of the reason that they've kept the trial open and they've not done a closure to move from emergency use to full authorization is the question of, well, how long does the immunity last? And so I think you're feeling pressure on the FDA, and I would actually expect in the next few weeks, if not even sooner than that, you're going to get movement of Moderna and Pfizer and probably the Johnson & Johnson vaccine from emergency use to full authorization.